All right. Hello, everyone. Thank you for joining us. I think people might still be joining us from the waiting room to the main room, but I think we can go ahead and get started so we don't lose any of our precious time with our guest and our speaker for today's noon lecture. Briefly, my name is Elizabeth King. I'm director of the Center for Russian, East European, Eurasian Studies here at the University of Michigan. And I'm very excited to introduce you all to our speaker, Olha Kostetska, who is joining us live from Kyiv. And before I do a full proper introduction, I just wanted to highlight a couple of our upcoming events. So our next CREASE Noon lecture is March 27th. We'll be joined by Togzhan Kasenova, who for a lecture on the atomic step, how Kazakhstan gave up the bomb. We'll be back in-person event in 555 Weiser Hall. And I'd also like to highlight a couple of our co-sponsor events that CREASE is helping with. March 1st, we're co-sponsoring the migration panel for queer-focused gender and sexualities in Eastern Europe and Eurasia that you can join by Zoom at this link or find on our website, or I believe people are putting it in the chat as well. And then March 14th, the Copernicus Center for Polish Studies lecture, What's in a Name? A Lot, From Gypsy to Rome, the Roma and Polish Discourse on Minorities, will be here in 555 Weiser Hall as well. And so we have those links for more information in the chat, but you can also find us on our website. But today, as part of CREASE and the Weiser Center for Europe and Eurasia, we are really happy to have, as part of our focus on Ukraine, a talk by Olha Kostetska, who's the public health lead at USAID Public Health System Recovery and Resilience Activity in Kyiv, and is working for the Swiss TPH. And this event is co-sponsored. We'd also like to thank the Department of Health Behavior and Health Education at the School of Public Health and the Office of Global Health, also at School of Public Health, for helping us to publicize and support our event. As I mentioned, we're joined by Olha, who's a public health and healthcare specialist focused on health system strengthening and resilience, as well as health policy. She holds master's degrees in healthcare management and in international law, and is currently employed by the Swiss Tropical and Public Health Institute, where she's leading the public health components of the USAID project, which she'll talk more in depth about during her talk here. Before joining Swiss TPH, Ms. Kostetska served as an advisor to a member of Ukraine's parliament on legal matters in the healthcare field to streamline important reforms of the blood donation system and the public health system, and to address some of the urgent emerging needs related to the COVID-19 pandemic. She also has extensive experience in legal consulting in the life sciences and healthcare sectors, and has advised public and private actors on various regulatory issues, as well as supported the implementation of key legal developments in the field. And so we're really excited and really, thank you very much for joining us. You came highly recommended from some longtime colleagues in Ukraine to be the person to talk about both healthcare reform, kind of ongoing and also current, and then all the work that you guys are doing on the ground to, support your country through this time of war. So I'm really, thank you for taking, I know you have a very busy schedule, and it's really hard to find time, but we're really happy that you're able to take a couple of hours to spend with us here for us to learn more about public health in Ukraine. I'll turn it over to you, Olha. Thank you very much.
Yeah, thank you, Elizabeth. Such a huge introduction. Hi, everyone. I'm really happy to have this talk. I mean, to have this opportunity, even though it's online. I mean, I still appreciate this opportunity to talk about public health situation in Ukraine, and to answer any of your questions, and to have a discussion. So please feel free to answer any questions which are of interest to you, and then during the Q&A session we will of course have this discussion. So I will share my screen right now to show you some information I would like to share with you. I do hope that you can see my slides well, and Elizabeth, please let me know in case anything goes wrong with them.
No, we can see the slides. Everything looks good. And I did fail to mention that for participants for the Q&A, you can type your questions into the chat box for Q&A, and then we'll go through them at the end of talk. So you can put them in anytime. But yeah, we can see your slides. Thank you.
Okay, great. So, as announced, today we will talk, of course, briefly, as we're limited in time, about the situation around public health in Ukraine. And of course, if we are talking about Ukraine, we are talking about the war context and respectively some challenges and opportunities faced by the public health and the healthcare system in general during the war, the large-scale war, and of course we will discuss some priorities that we see at the country for the post-war recovery. Just a moment. So basically, it's the plan for today's talk. I won't stop here for long, but important thing first, I would really like to use this opportunity to thank you for all the support you've been providing to Ukraine, because really it's, I mean, it's for real that I wouldn't have been able to talk to you from Kiev right now if it were not for the American support. So we as Ukrainians really do appreciate this and really do hope that the support continues. And I am actually an employee of the USAID project implemented in Ukraine. So it's again thanks to your support that we can help our public health system sustain during this really difficult times for our country. So actually, Elizabeth really covered all my background. I won't stop here. What I would like to mention, just for you to understand what I've been doing these years, I mean, I was lucky to have a chance to work in three kind of sectors, focusing on healthcare and public health in public sector as an advisor to an MP, and in private sector in life sciences and healthcare consultancy, and now I work actually in civil society sector. So it gives me kind of a more comprehensive look, I believe, at some things which are happening, and I will be happy to share my experience and my point of view, but maybe important reservation for this talk is that it is based on some recent very authoritative sources like WHO reports, some other reports, but of course it's a bit subjective, and it's I do not aim to cover anything which happens currently in Ukraine in the healthcare field. So of course it will be much more behind this talk. So first, I would like to set briefly the pre-war context, because some processes which started before the large-scale war, they have a great influence on what is happening in Ukraine now. So first, the health status of the Ukrainian population, it wasn't that good even before the war. We do have one of the shortest life expectancy in Europe, and actually we have a very obvious health inequality in terms of life duration of expectancy between men and women. It's 10 years, and it's significant. And we do really have a high burden of non-communicable disease, mostly cancers and cardiovascular disease, and they cause more than 90% of death in Ukraine, and behavioral and biological risk factors are also very, very prevalent. As a part, of course, of NCDs, we have very high prevalence of mental disorders. So before the war, 1 in 8 adults had symptoms of some of mental disorders. And now, of course, this figure is really higher, which I will show a bit later. And we also have some problems with vaccine preventable disease. We have really low vaccine coverage historically, just because of vaccine hesitancy, because of misinformation, and also some supply side issues also happens from time to time. So we didn't achieve the target of 95% coverage rate for any actually vaccine preventable disease, even though we have 10 routine vaccines and COVID-19 vaccine free to the population and included into the vaccination schedule. And that's why, including for these reasons, we have had a few really significant outbreaks of vaccine preventable disease, such as measles and hepatitis A in the recent year. Sorry, yeah. But still, we at the country have been doing our best to streamline some very important reforms of the healthcare system in general as a whole and of the public health system. You might heard something about the healthcare reforms in Ukraine, and it's a huge separate topic, but just to put it very briefly to you, starting from 2017, a comprehensive law was adopted to kind of switch the financing of the healthcare system from a very outdated scheme where all the finances were allocated based on the number of hospital beds, but not based on the performance. And the principle money follow patient, meaning that those healthcare facilities which serve many more patients should get more financing from the state. Under this law, we established a single strategic purchase of health services, which is the National Health Service of Ukraine. And we established the health benefit package, which means the healthcare services which are provided for free to the population. However, we're still having some problems with defining this list because we do not have a very clear positive list defined. So it sometimes leads to some coverage gaps on practice, even though on paper we have kind of everything to be provided for free in the country. And this reform also foresees that hospitals are no longer kind of public institutions. They're still public institutions, but they are autonomous and they serve as public enterprises. So they are kind of responsible for their own financial well-being based on the number and quality of services they provide. We are still having, and before the war, we still had some problems with health system performance. Still, the health spending, public health spending, is one of the lowest in Europe. It's around 40% of GDP before the war. And informal payments are pervasive across the country, and out-of-pocket spendings constitute a very, very large portion of health expenditure for the population. And even though we have very short waiting periods, really short waiting periods to get health services as compared to the European countries, for instance, the quality of this care really varies across the system. And also, public health system has been undergoing some important reforms, especially after we learned on COVID-19 experience. It happened during the war in 2022. Again, comprehensive law was adopted to establish the new regulation and to define the key functions of the public health sectors, and to establish some oversight and control powers across the system. The logic of this reform, I would say, was to bring back the vertical subordination and to subordinate regional kind of CDCs. They are called actually CDCs, regional CDCs, Centers for Disease Control and Prevention, directly to the National Ministry of Health of Ukraine, because previously they were autonomized, but it really didn't work during COVID-19 pandemic. And what is also important in this reform is that there has been a very significant shift from focusing on infectious disease only, which was kind of a very natural function of this predecessor of this regional CDCs. They were previously laboratory centers, so they really focused on infectious disease only, and now they are responsible for the whole health of population, meaning also having to work on NCDs, on health promotion, on mental health issues, and it's a new area for them, and these institutions, these new regional institutions, they are to be strengthened, and they are to really acquire and embrace these new functions, and also some mechanisms for coordination across the system are now in the process of development based on this reform. So, turning to the key challenges we see in the public health and in the healthcare in general in Ukraine during this large-scale war. And of course, when I speak about the war, I'm speaking about the large-scale war which started in February 2022, although we have the war with Russia for 10 years now. So, of course, the key dangers and threats, they are kind of classical for all the emergencies, for a lot of emergencies and a lot of armed conflicts. So it's, of course, population displacement, it's casualties, it's damage to healthcare infrastructure, and risks related to both infectious disease and non-communicable disease, mental health issues, of course. This is also affordability and accessibility of health services. Some impact on environment, and of course environmental and technical hazards, and access to water, sanitation, hygiene, and food insecurity, and a lot of other challenges. I just stopped here not to expand this list even more. So speaking about population displacement, it's been, I'm sure you know it very well, that it's been the largest refugee flow in Europe since the end of World War II. Actually, more than 6.3 million Ukrainian refugees have been recorded globally. And we have around 4 million people internally displaced in Ukraine. It's really difficult to calculate these figures because people are moving back and forth through the border and in Ukraine, so these figures are just approximate, and up to 15 million of people do need humanitarian assistance this year. It's really a huge number if you just think about that. Of course, it's very important to understand that a great number, Ukraine is a large country, and a great number of people still live in frontline regions, which are very close to very active hostilities, and a lot of people live on the occupied territories, which pose even greater concern than the population displacement and the people who manage to come to safe places. When I was looking for, a reliable figure of civilian casualties, I only managed to find this figure, something around 30,000, but the actual figure is considerably higher, and I highlight considerably higher, but we really don't know how many people we lost. A lot of people do need humanitarian healthcare, and the whole healthcare system feels this demand, changes in the structure of the needs of the population, because when you live in the country with active hostilities and with constant missile attacks, of course, you need a lot of emergency services, trauma, burn scale, limb saving, other surgeries, and of course rehabilitation. And yeah, we should not really forget that displacement is not only about like going to a safer place, but it's also about causing some very significant impact to the public health system. Healthcare infrastructure has been severely damaged. It's like you can see more than 1,500 attacks on healthcare infrastructure, and of course it does have consequences. It does increase the cost of health services and medicines. It's broken supply chains, logistical troubles. It does impact access to services, and a lot of healthcare personnel is displaced. And we do see large delays in healthcare just because people are scared, just because people cannot access services, just because people cannot buy medications, and sometimes their medical records or other documents are just lost, and a lot of other consequences for the system. I won't stop here. It's just it's just to really highlight that people who are displaced, they are really vulnerable, and they need financial support. They have very basic needs such as solid fuel, such as information, communication, and of course medicines. Going to other threats that I mentioned, infectious disease. As I said, even before the war, we had quite low vaccine coverage, and it was even further exacerbated by the war. And of course, is because sometimes supply chain was disrupted, and vaccines cannot be delivered to particular regions. Sometimes it's just damaged infrastructure, which takes time to rebuild it, and population displacement makes it really hard for GPs in particular to keep track. To keep records of vaccinated people, of unvaccinated people, and to keep this process in a consistent manner. And recent studies show that really internally displaced people are less likely to access preventive treatment, and including vaccination, just because they have so many pressing issues that they just delay all the healthcare issues. And of course, this can also cause vaccine outbreaks of vaccine preventable disease. Here you can see that actually neither of the mentioned disease have the vaccine coverage which would allow to achieve herd immunity, which means that we are really prone to the risk of outbreaks. What I would like to mention here is that COVID-19, it was really an interesting experience from us, because we switched right from the COVID-19 crisis, from the pandemic, and the figures, the morbidity was very high in February 2022. It was one of the peaks, actually, but we switched right from this crisis to the war crisis, which turned out even greater crisis. So COVID-19 has a bit lost this sense of being a huge public health threat, but this may be simply due to limited testing during the war. Again, people have other priorities, and to disrupted surveillance. Still, the morbidity is quite high, just because we have the lowest actually vaccine uptake rate for COVID-19 in Europe. We have some moderate outbreak potential for diphtheria and cholera, but of course, this disease are more likely to have an outbreak given the living conditions. A lot of millions of people have actually. Some of them live in collective shelters. Some of them don't have access to wash, and for some of the disease, we do not have enough of toxins and the other reasons. and HIV, hepatitis C and B, and tuberculosis, and including drug-resistant tuberculosis, are also still very important and pressing issues, just because we have very, very, very high prevalence of this disease, and just because during the war, people are more likely to stay undiagnosed and untreated, and to face some delays again in their care. Non-communicable disease, it's the burden is really increasing just because risk behaviors increase. People smoke, people use alcohol just because they're stressed, and because there is really hindered access to care. And we observe that the largest gap now is in cancer diagnosis and treatment. It's like 1/3 of patients cannot access these services. I want to stop here. Really, it just says that around 14% of people face some barriers when trying to access some care for chronic conditions, and one of the main reasons is cost of medicine and cost of treatment, or time people need, or transport problems. And here it says that again. People face different problems trying to access healthcare services for chronic conditions, and mostly and for other conditions, and mostly it's about lack of healthcare staff, or lack of training, or lack of medical supplies, or or medical equipment, or lack of financial resources. Mental health. Actually, it's a huge topic in Ukraine, and I mean worldwide now. Just because in Ukraine we have a huge prevalence of mental health trauma, and now we have as many as 1 in 4 people living with a mental disorder. And most common disorders during the war are anxiety, depression, PTSD, acute stress disorder, and substance abuse. These conditions are getting worse, including for the reason that people adopt negative coping strategies, and we do understand that, and the recent studies show that this mental health trauma can really become intergenerational, and the situation is even more difficult because we have a really before the war, I would say, we had a really institutionalized, biologically oriented approach to treating mental health disorders, and now we are trying to, and we are establishing, and we are developing this person-centered and community-based approach. But of course, it needs some more time to really get well developed and well established. And stigma and mental health stigma is still really pervasive, and mental health awareness is really still really low. For instance, one of the studies show that only 1/3 of people really know where they can get some mental health and psychological support services in their community, and only 20% of the population can really pay for these services. Other hazards include constant living under a constant threat of being in an area where chemical, biological, or radiological, or nuclear agents can be deployed. It can be both intentional and accidental use. For instance, we have a number of nuclear power plants, and one of them is Zaporizhzhia power plant, where the Russian army established their troops and munitions, and it's just mined, and it can be blown up every day, and the impacts will of course be much larger than just Ukraine. That's a constant threat. And of course, you heard about the destruction of Kakhovka Dam. That is the biggest environmental catastrophe in Ukraine since Chernobyl disaster. and it was a huge number of people affected, a huge number of animals died, which is also horrible, and it was severe deforestation, severe release of some bacteria into the water, trauma for people, and destruction of infrastructure, and of course a lot of other consequences which were brought about by this horrible accident. I'll say a couple of words about health services and medicines. We still face issues with the accessibility and affordability of these. We see that here we can see that really a significant number of population cannot afford medical services and cannot afford medicines, and really a large number of households become financially vulnerable just because they have to pay for healthcare, and very often actually this spending becomes catastrophic health spending, and it is estimated that almost 1/3 of the population actually have someone in their family who stopped the medication during the war just because it was no longer affordable. And of course, affordability is much more of an issue for regions without active hostilities, while for regions with active hostilities, it is much more about accessibility. I won't stop here really because I'm trying to be time-wise. I see that there is not that much time left, but another major public health challenges are, of course, access to wash, right? It's antimicrobial resistance. This is because antibiotics are used in a very chaotic manner. And of course, that's not the biggest problem when treating wounded and so on and so forth, but still it's a long-term impact on the health of the population. And mining, as Ukraine is now the most heavily mined country in the world, food insecurity with really high inflation impacting food prices, sexual and gender-based violence, especially in these places where people have poor living conditions, collective shelters, and especially for women with children who are traveling, who are relocating. And other risks associated with living in shelters actually just can get all the pre-existing conditions worse, and it can bring some cold-related injuries to people and frostbites and so on and so forth. And health workforce disruption. Some regions which are close to the battlefield, they face up to half of their population being moving out of the region, and the staff shortages do really impact the accessibility of healthcare. Still, we are actually working a lot to make the situation better. A lot of actors are working together to really support the public health system, the healthcare system, and their national and foreign and international. So we have some ministries such as the Ministry of Health of Ukraine, the Center for Public Health of Ukraine, which is an important expert institution in public health of Ukraine, the National Health Service of Ukraine, and other state institutions. We have, of course, academic and research institutions and NGOs working together. And we have regional levels, as I mentioned, CDCs, health departments, and local levels, actually health facilities, local authorities, making a lot of efforts. And of course, we have foreign governments and government institutions supporting Ukraine, foreign donors funding projects in public health, and we have international organizations also supporting Ukraine. I will be rather short here, just to say that we can see some really important steps taken to prevent some catastrophic risks to the system. We have a few really intersectoral strategies adopted during the war to focus on health system resilience and post-war recovery. And in mental health, it's been even a separate body established under the Cabinet of Ministers of Ukraine, the highest executive body, to implement the All Ukrainian Mental Health Program, which is initiated by the First Lady. And a lot of public information and communications campaign are being implemented to inform people about the threats they may face, about the behavior they should adopt to stay more healthy in these conditions. And of course, a lot is being done to enhance the emergency preparedness and response of the system, speaking about, again, this chemical, biological, radiological, and nuclear threats at all levels. So we have rapid response teams established at the national level, at the regional level, who are ready to react, to go tackle in case there is an accident. And we have a new electronic epidemiological surveillance system established to improve this record of risks and of disease, and working on the laboratory network, on AMR control, and on the necessary supplies. And also, of course, access to services, which is really important for people. It's support to healthcare infrastructure so that they can function and can provide services. And there has been a lot of work to optimize service delivery, especially at the primary healthcare level. For instance, mobile teams to go reach some vulnerable groups. A role of nurse, of medical doctor being revised to make them more efficient. Some community outreach schemes are implemented, and so on and so forth. And of course, mental health and psychological support services are being integrated into the primary healthcare and are becoming more community-based to help population reach these services. Post-war recovery, we are thinking about post-war recovery, even though we really don't know when this horrible war is going to end. But still, some of the key priorities, which are actually defined by WHO, are reconnecting people to care and addressing new needs which emerged during the war in terms of service delivery. And of course, continuing public health system developments to make it stable, to make it autonomous, protecting the reforms already implemented and the established institutions, and investments for sustainable progress. Talking about service delivery, it's mostly about meeting all the needs population may have, and very, very specific needs which may arise during the war, and making the network of healthcare facilities really efficient so that it can cover the population needs, and making services more people-centered. As I said, when we are talking about the system, it's about institutions, it's about supporting them, it's about making sure that these institutions are ready to deliver, to implement the core public health functions, and doing some capacity building for these institutions. And of course, public health workforce development, and integrating all the components of health, NCD, mental health into the functions of the key public health institutions, and actually promoting health-seeking behavior among the population. In this sense, of course, it is very important to keep the reforms going even during the war. I mean, we haven't stopped streamlining reforms in Ukraine during this war to continue this program. But this progress also means that healthcare in Ukraine becomes more transparent, more accountable as a system, and anti-corruption measures are implemented. And investment is, of course, important just to sustain the system and to plan the finance allocation wisely, focusing on the essential services, access to essential services, equity, and resilience. And lastly, just a few words about the project I'm currently working in. It's the USAID Public Health System Recovery and Resilience Activity, PHSR&R, we call it, just because of this long, difficult name. So we have really a lot of money to spend on public health, not on ourselves, but on public health in Ukraine. And this is a 5-year project, and we are already in the second year of the project implementation. We have 3 key institutions implementing the project, which is the American NGO, actually, PAC team, and this one I'm working at. I mean, I'm employed by this institution to work in the project, Swiss Tropical and Public Health Institute, even though I work in Ukraine, and European Institute of Public Health Policy. And we work with some key partners at the national level, which is Ministry and Center for Public Health of Ukraine, and with regional CDCs, and of course other actors. We implement a lot of activities nationwide, meaning on the whole territory of Ukraine, but we are focusing with some activities with more tailored ones on 8 regions of Ukraine and on some territorial communities. And really the aim of this project is to strengthen the government of Ukraine, to make it ready to prevent, detect and respond to public health threats and to sustain critical public health services during the crisis, and to expand mental health support to veterans and war-affected populations, and protect the health of all Ukrainians, including some vulnerable groups. These are just key areas we focus the project on. This is the Global Health Security Agenda, this framework, USAID framework, Reconnect People to Care, which is about access to services, and as a separate component, and a very important one, is access to mental health and psychological support services. One of the last slides. So this is just one of the last slides to really, sorry, I can't get away with this panel, but still, so this is some key areas of our work and achievements, very few of our achievements in the project actually, and this information is of 2023, so it has to be updated. We are doing some systems strengthening activities, which are about policy development, about strengthening institutional capacity of these newly established institutions, and we are supporting this National Coordination Center on Mental Health and supporting local CSOs working in public health field. And one of our achievements is that this year we established the first all-Ukrainian Public Health Association to serve as a networking platform and a professional development platform for public health specialists across the country. We're also focusing on public health workforce development, and we train a lot of specialists in emergency preparedness and response to biological threats, crisis communication, social behavior change communication, data-driven decision-making, immunization, NCDs, and a lot of other topics. Also, mental health and public psychological support services, trainings such as MHCAP, CETA programs, and other programs. We are working now on establishing academic partnerships between the US universities, namely Temple and Drexel universities, and our Ukrainian universities to improve our Ukrainian public health and mental health programs at the bachelor's and master's level. And we are implementing some mental health education program at school. Also, we try to ensure, even though we do not have all the functions as the governmental institutions have, but at the project we are contributing to vaccinations, we are contributing to access to mental health services, for instance, we are also supporting some screenings, for instance, on cervical cancer, and we are trying to implement such really expand service delivery schemes which really expand access to services in territorial communities, and we are also implementing some nationwide and regional communications campaigns on immunization and health-seeking behavior. And finally, just a very few photos I thought would be really interested to share, but we have much more. So the first one is the USAID, our project directory with the USAID representative head of health office and with the representative of National Coordination Center on Mental Health signing the memorandum on cooperation. And then you can see Samantha Powery and our first lady Olena Zelenska visiting one of the mental health center near Kyiv, which was opened near Kyiv with the project support. You can see a pic from here to the left. You can see a pic from the All-Ukrainian Public Health Conference with international participation we held in one of the western cities of Ukraine in October of the previous year. It was one of the first huge offline events after COVID during the war. And here you can see the founders of the Ukrainian Public Health Association. This first of Ukrainian Public Health Association speaks from our trainings from our trainings on these are people from regional CDCs and from healthcare facilities to learning incidents and learning to respond to biological incidents and learning to provide mental health support. And finally, the photo of our really small part of our project team in our Kyiv office making some healthy treats for our army, for our defenders before the new year in Ukraine. So we just felt like doing something pleasant and something to thank our defenders before the new year. And I believe that's the references, as I said, some reports for my talk. As you can see, we used this reservation on all the materials. As you can see, we used this reservation on all the materials we produced. This is really made possible by the support of the American people through the USAID. So thank you again for your support. Really much appreciated. Thank you for your time. I hope I didn't take too much.
Yeah. Thank you so much, Olga. That was really informative and really powerful to share with us. I think people have already started entering some questions, but I'll remind from the audience members, if you have questions, you can type them into the Q&A. But I can start with the first one, and actually I'll read them both because they're kind of uncannily connected. So Jessica Robbins-Punko asks, first they thanked you so much for this comprehensive presentation. And she's wondering if you can speak to the primary health challenges facing older adults and persons with disabilities. And then Mary Janovic also writes, thank you for a wonderful talk. What are some of the special challenges of the elderly population during the war, and how are they being addressed? So since they're similar questions, I thought I could ask them both at the same time.
Yeah, thank you. Thank you very much for these questions. I will do my best to address them. Well, maybe the key point to understand here is that when you live in a war, any vulnerability you had before the war is just it's just getting worse, and people who were vulnerable, they become even more vulnerable. So actually the problems for elderly people to access services, healthcare services, they are actually the same as before the war, but they actually got worse. For instance, I will start with the with the issues we tried to address and tackle as the project, and maybe then talk about the other ones. So one of the problems is vulnerability in terms of vaccine preventable disease. These are usually people belonging to high-risk groups, for instance, for COVID-19. and sometimes they do not feel like getting vaccinated for a lot of reasons, a lot of different reasons. Sometimes they don't want to. Sometimes they don't have access to a facility where they can get a vaccine, just because they do not have a vehicle to get there, just because they don't. They might even not have enough money to go to a larger city, maybe to get vaccinated, and sometimes they simply don't have enough information to understand why it is important and where they can get this vaccination. So here we tried to implement some actually a nationwide campaign with a very large coverage, inducing elderly people to get vaccinated from COVID-19, and it showed some good results, like persuading people, elderly people, to get vaccinated. And actually, quite similar to vaccination is the situation with non-communicable disease. Again, as I said, there are a lot of cases of delayed care, a lot of cases of delayed care especially for managing chronic conditions. And although we have some medicines for treating NCDs available for free at the pharmacies, during the conflict in some regions, sometimes it's really harder to get to, especially at the first stages of the conflict. Even in Kiev, it was very hard to get medications in pharmacies. Of course, there may be some supply breaks and again, lack of information about getting these medicines, and lack of a constant contact with the GP relocations, which are really difficult even for younger people, not speaking about elderly people, which really can get their chronic conditions even worse, and not speaking about mental health impact, which is still not properly, I would say, addressed in all the, I would say it's not ideally addressed in all the regions in Ukraine at the primary healthcare level. So we're developing this system, but of course, a lot of people, including elderly people, are living under this huge stress and trauma, and they can't get all the treatment they need at the primary healthcare level. So these are just a few. I mean, I'm sure there are a lot more other challenges.
Thank you. Another question's coming in, also from a colleague at School of Public Health. Irina Bondarenko writes, what are your thoughts on how schools of public health of major American universities could help to build or strengthen Ukrainian public health? Will some educational programs have an impact?
Yes, absolutely. Thank you for bringing this up. As I mentioned very briefly during my presentation, but actually it is one of our very important areas of work as a project now, and other projects in Ukraine are doing the same things, understanding their value, is to bring this connection, to establish this connection between the American universities and other educational providers and the Ukrainian ones focusing on public health, and especially public health, actually. So what we are doing now is we selected a couple of Ukrainian, like 3 Ukrainian universities, which have public health master's programs. And we are bringing them in touch with the American universities so that they establish kind of a working group. The representatives of the universities establish a working group and work on the improvement of the Ukrainian public health master's programs, so that they become more contemporary, more comprehensive, more tailored to the specific needs. And the same story is about mental health programs. in Ukraine, they're still very, they're outdated at the universities, and in the US, you have much better experience in teaching people how to become, for instance, a mental health nurse. We don't know this. We don't really have this. The staff in Ukraine. So again, we as a project now trying to establish these programs in the Ukrainian universities. Some of them may be shorter, and some of them may be comprehensive master's or bachelor's programs. Also, we, as I mentioned, we have some regular online and it's rather online, but sometimes even in-person events where we always invite international speakers, always invite academia representatives to talk about their experience, to give some recommendations in terms of the post-war recovery priorities for Ukraine, and of course the priorities during the war. So actually a lot of platforms and instruments to establish this connection, and it's really useful. I mean, Ukrainian public health education is to be reformed definitely, and now it's in process.
Yeah. Okay, another question. Nick Dychakivsky, probably did not pronounce your name right, I'm sorry, writes, thanks you for the talk, and wants to know specifically about mental health needs. Are there some connections being made between community-based solutions and other community building efforts? For example, is there a potential for participatory processes aimed at recovery and reconstruction involving some mental health therapy components? Would this be something for the Public Health Association to look at? And I was also kind of wondering, like, when you had all the constituents for the USAID program, wondering about like the NGOs or civil society role, how they're involved. So kind of maybe those tied.
Thank you for this wonderful question. To be honest, I'm not really an expert on mental health in our project, but I know some of the activities which are going on. Of course, our focus at the project, and I would say it's really common understanding across the country and across the projects working in the country that mental health services shall be community-based and shall be people-centered and shall be linked to other community-based services. And we do support some peer groups, for instance, where people meet in the community, and they can be engaged in different activities, and in the process they get some mental health improvement. We are also, as a project, we are supporting trainings, as I mentioned, for social workers and for primary healthcare providers to teach them this basic skills in providing this really basic, I would say, mental health support. And we are supporting this kind of establishing we call it care for myself sites in the communities, where people can have some time to do some sports and also to do some kind of meditation, I would say, and they also receive information and links to the places and to the opportunities of receiving some mental health support. We are also implementing some information and I would say health-seeking behavior campaigns, including on mental health in the communities, where people are encouraged to pay attention to their needs, to pay attention to their mental health issues, and they even get some tracker of these issues to pay attention to, and they receive information how to how to best address these issues. And now I know, but again, I'm not the best expert to refer to, but I know that the idea in the government is to establish something like community resilience centers where you can have all the kinds of support actually you need, and including mental health support. So you can have a talk with the social worker there, and you can have a talk with the GP there with the psychologist, and of course with your friends and your colleagues, and do some art or other therapy. So yes, this idea is definitely existing and very actively developed in Ukraine. And of course, this is also one of the fields where a Public Health Association would like to invest some resources into.
I have one last question, and I don't see anyone writing in, but maybe it won't be the last, but I'll ask it quickly before we end. I was just wondering if you could kind of talk about, like, you presented a lot of information, and I was like, the whole time I was kind of thinking about, like, with this resilience and recovery, kind of given the multitude of challenges even before 2014, and let alone before 2022 within that, like, Ukrainian healthcare system, and thinking from like this health policy standpoint about all of the reforms that have been happening in Ukraine in the healthcare sector, and then thinking, how amazing, we've kind of watched Ukrainians to have been able to demonstrate extreme resilience during the last couple of years. I was just wondering, like, when you think about this and like the reaction, because some of the indicators you've shown improvement on, right, even during wartime, and I was just wondering, like, has the war demonstrated like what parts, like any parts of the Ukrainian healthcare system that's been maybe even like surprisingly resilient, but somehow having this like kind of thinking about the assets based approach to thinking about, what are parts of the Ukrainian healthcare system that have really shown to be strong?
Mm-hmm. Yeah, that's a wonderful question. Thank you. It's a difficult one. I would speak right out of my mind. The first what comes to my mind is the resilience of the primary healthcare, which we observed both during COVID-19 pandemic and during the war, because as I mentioned, for us it's like one crisis continuing into another crisis, so we didn't have a break. And even though the healthcare infrastructure was severely impacted during the pandemic and of course during the war, I would say that the healthcare system definitely sustained. So even though I mostly actually in this slide, I mostly focused on some negative impact of the war, just because, it's not to say that the war is not unnoticed in the Ukrainian healthcare, in the Ukrainian for the Ukrainian population, but still, even though we have had this really bad impact on some kind of accessibility of services, availability of services, the healthcare system mostly sustained, and we didn't face any severe gaps in access to healthcare. Of course, talking about regions with active hostilities, it's more difficult for people to go and get what they need. But even if we're talking about the Donetsk region, which is one of the most heavily affected by the active hostilities, primary healthcare centers and specialized care centers function there, and medical personnel does stay there to deliver services to the patients, and digital healthcare system works there. Maybe that's another component which proved quite resilient. Of course, it's always there is always a room for improvement, and we do see it as living in this country. But I would say it's really, surprising sometimes to think about being able to kind of get your medical appointments for today or tomorrow just using an app or an electronic system in a country which is under heaviest missile attacks ever in the world. So I would say that the healthcare system has been doing quite well in terms of this overall resilience. And of course, there has been quite a large outflow of medical staff, and especially frontline regions. And not only frontline regions. For instance, I'm originally from the central part of Ukraine, which was not affected by the direct hostilities, but of course is suffering missile attacks as any other region. There is a lack of medical personnel there as well. So all the regions of Ukraine suffer from the lack of medical personnel, but I don't believe that any reform which was and has been implemented could have fixed that or could have prevented that, because for obvious reasons, people are trying to get to somewhere more safe. I would say that maybe specialized, the reform in Ukraine started from primary health care, and it was quite successful on this level. The problem with specialized healthcare reform, which has been implemented and is in process, is that it started right during the beginning of the COVID-19 pandemic. So implementing this kind of huge reform in a situation where hospitals are just, reprofiled to admit COVID-19 patients, and they're all occupied with that. Maybe that also had an influence on the whole system, but still. Again, the specialized healthcare is also quite sustainable. And what is even more, we are talking sometimes about that, is it is again common knowledge that in Ukraine we have quite an effective hospital network. So we have much more hospital beds that is an average in Europe. And we have much more hospitals as buildings as compared to Europe again. And of course, it's not that efficient to keep this infrastructure going just because it is not needed, and it can be done in a more efficient manner, reorganized. So when we faced these numerous attacks on healthcare infrastructure, it's horrible. I mean, any attack on hospital with patients and with medical personnel, it's just it's beyond horrible. But speaking of buildings as such, speaking of network, this losing some of the facilities proved another time that there is no need in having so many facilities, and that the network should be reoriented and reorganized to serve population health needs. So of course, this is the way to go for Ukraine. And this is what the government is working on, making this network more efficient and more logical. So yes, the war has been just another proof of that. Just some random thoughts. I mean, this is a very very difficult, comprehensive question.
Thank you. Great. So thank you so much for sharing all that information. Very interesting, informative talk. And thank you all for attending, especially for those who could stay on. I think we went a little bit over our allotted 1 hour time, but and thank you for participants who shared questions as well. I think we can end the webinar, and maybe everyone can join me in thanking, at least virtually, Olga, for your time. And
thank you very much.